parathyroid gland. The parathyroid gland is located on the posterior side of the thyroid gland. There's the two up at the top, which are the superior parathyroid glands, and the two at the bottom, which are the inferior parathyroid glands.
Good morning, class. Today we're talking about the parathyroid gland. And what do these four tiny glands do, you might say? Well, it monitors the calcium levels in your blood. And when you have low calcium levels, it secretes parathyroid hormone, or PTH. And it secretes it to the bones, the kidneys, and the intestines. And it signals the bones to increase the deposit, or to eat away the deposits of calcium and push them into the blood. And signals the kidneys to activate vitamin D, which we all know helps with the absorption of calcium. And it also signals the intestines to be on the lookout for calcium and to increase its absorption. And to show you how this is done, we have a quick demonstration for you.
Hello, parathyroid hormone here.
Oh, hi, this is the parathyroid gland. I'm getting a feeling that there's some low calcium in the blood. Can you help me out with that?
Yeah, sure. Let me just contact the intestines, the kidneys, and the bones, and I'll see if we can get some levels raising.
Sounds good. I'll keep an eye on that calcium for you.
Hey, Bones here. Hey, Bones. It's PTH. We're running a little low on the calcium out here in the bloodstream, and I was just wondering if you could get any of that released for us.
Well, since I'm the main storage of calcium, I'll get that released right for you.
Thanks, man.
Hey man, you need to go out and do your job.
Oh, okay, sounds good. I'm on it.
Hey, boss, it's me. So I talked to the kidneys, the bones, and the intestines. How are you liking these levels?
It seems I'm getting a good reading on the calcium levels here. You're doing a good job. You can come on back if you want.
All right, see you soon.
See you.
Hypoparathyroidism is a deficiency of PTH that is usually due to surgery, but may also be caused by hypomagnesia or may be due to an unknown cause.
Signs and symptoms of hypoparathyroidism include tetany, tingling and numbness in the extremities, stiffness of hands and feet, bronchospasms, laryngeal spasms, carpal pedal spasms, anxiety, irritability, depression, and changes in ECG.
Interventions. Increase serum calcium levels to 9 to 10 milligrams per deciliter. Calcium gluconate IV. Sedatives such as etobarbital to decrease neuromuscular irritability. Quiet environment and dim lights. And your diet should be an increase in calcium and a decrease in phosphorus and vitamin D.
So education to teach your patient for hypothyroidism would be to make sure that they are prescribed the right drug regimen, teaching them ways to reduce their anxiety such as Tai Chi, massages, or just simply deep breathing, making sure that they are getting a nutritious diet that is high in calcium, magnesium, and vitamin D. This includes foods such as leafy greens, fishes, sardines, and nuts, and making sure that they are wearing a medical life alert bracelet in case of an emergency, and just to make sure to provide to them that this will be a lifelong drug therapy.
Hey Marty,
Hey.
this is Kate. She's going to be
Hello.
your PM nurse tonight.
Okay.
And is it okay if I give her bedside report?
Sure.
Okay. This is Marty. He's a little confused. He just had a radical neck dissection earlier today. We were concerned because he is having signs and symptoms of tetany, as you can see with his hand, delirium, as I said, he was confused, and he's having numbness and tingling.
So you're thinking it's hypoparathyroidism?
We haven't ruled it out yet. We're just still waiting on some results to come back.
Okay. Well, I'm going to take good care of you tonight, and I'm going to make some rounds, and I'll be back in an hour, within the hour.
Okay.
Marty, how are you?
Well, I'm okay.
Okay, well, we got your lab work back, and I think due to the radical neck dissection, it shows that you have decreased levels of calcium in your blood, and it's something that we call hypoparathyroidism. There is actually no replacement therapy for this, but we do encourage, we're going to give you some vitamin D supplements, calcium supplements, and magnesium supplements.
That's a lot.
It is a lot, but I think that this is going to significantly help you, and we're also going to give you something for your tetany, and this should go down, and your muscle will be more relaxed.
Okay.
Do you have any further questions?
No?
Okay.
Okay, now we're going to talk about hyperparathyroidism. Hyperparathyroidism is when the parathyroid excretes too much PTH. This can cause dysfunctions in the circulatory system, such as atherosclerosis, disrupted electrical conduction in the heart, which can lead to AFib and palpitations. It can cause the formation of kidney stones, or an alter in cognitive functioning, which can have slowed neurons, which causes poor concentration, tiredness, and memory loss. Other common symptoms of hyperparathyroidism is gastroesophageal reflux disease and abdominal discomfort. And here's an example of a patient presenting hyperparathyroidism.
All right, so we have Kayla here. She presented to the emergency department yesterday with extreme complaints of abdominal pain at 10 out of 10, and same with bone and joint pain. And she also had some weakness and complaints of loss of appetite over the past few days. And she has had excessive urination as well.
Okay, have there been any blood tests done?
There have, and her calcium level was extremely high, at about a 15. So, and they haven't ruled out parathyroid gland or hyperparathyroidism. So.
All right, so we're going to do some more tests on that.
We are.
All right. Hi, Kayla. How you feeling?
Okay.
All right, I was just coming in to let you know we got your blood work back, and your calcium levels are looking pretty elevated, and the doctors think it's hyperparathyroidism.
That sounds scary. What is my treatment option?
Well, we could do hydration therapy, or we could also do a parathyroidectomy, which is the removal of your parathyroid, which is looking like our option here. How do you feel about that?
I guess that'd be fine. Do I get to place it where I want it to be?
Yeah, sure. Where would you like your parathyroid placed?
I would like it in my great toe.
All right, I'll talk to the doctor, and it looks like we can get our parathyroid placed in the great toe. Sounds really nice.
Guys, I was just thinking, the parathyroid gland blows my mind.
After that lecture, I just can't get enough of it.
I know. You can take it out and put it in like your great toe.
Are you guys talking about the parathyroid gland? I love that gland.